You know, everyone has one. That little, unique mark right in the center of our belly. We call it a belly button, but what it really is our very first scar. It's a permanent reminder of that incredible lifeline that connected us to our mothers. But have you ever stopped to think about the whole journey? From a complex, vital cord to a simple little navel? So let's get into it. Let's dive into this amazing story of connection, separation, and healing. We're going to explore the fascinating transformation of the umbilical cord, from what it is at birth to the common, and yes, sometimes not so common issues that can pop up along the way. Okay, so to understand the belly button, we have to start with the structure that actually creates it. What exactly is an umbilical cord at the moment a baby is born?
Well, first off, the umbilical cord is not just some simple tube. It's a highly specialized, brilliant little organ. Inside, you've got two arteries that carry waste away from the baby and one single vein that delivers all the good stuff, all that vital oxygen and all those nutrients. And the whole thing is protected by this amazing substance called Wharton's jelly, which is basically a biological cushion that keeps the cord from kinking up.
The physical specs of the cord are also incredibly important. At term, it's about 60 centimeters long. That's roughly 2 feet. Now, a cord that's too short, say less than 35 centimeters, can sometimes be linked to developmental issues. And see that point about coiling? It's so cool. The vessels inside are actually longer than the cord itself, so they twist around each other. This coil is a genius natural design to protect the blood supply, but on the flip side, too much or too little coiling can be a sign of potential complications.
So what happens right after birth? Well, the cord is clamped and cut, and that begins its journey from being a lifeline to becoming a navel. The care that this little stump gets during this time is absolutely crucial.
And what's really interesting here is that the best practice for cord care actually depends on where you are in the world. In a hospital setting with sterile equipment, the recommendation is simple. Just keep the stump clean and dry. But in low-resource settings, studies have shown that applying an antiseptic called chlorhexidine can dramatically reduce the risk of serious infection and even mortality. It's a perfect example of how vital context is in healthcare.
So, how long does the stump usually stick around? Typically, it dries up and just falls off within the first week. But hey, don't panic if it takes a little longer. Up to 3 weeks is still considered totally in the normal range. It's really only if it's hanging on for more than 3 weeks that it might signal some kind of underlying issue, like an infection or maybe an immune problem, and that's when it's worth a chat with your doctor.
All right, so once the stump is gone, the new belly button isn't always perfectly flat and neat. There are a few very common surprises that can appear, and you know what? For the most part, they are completely harmless.
The most frequent little visitor is this, the umbilical granuloma. If you see a little pink, moist, kind of fleshy bit of tissue right in the belly button that just won't dry up, this is probably what you're looking at. It's simply some extra healing tissue that formed during the process.
And the good news is it's such an easy fix. A healthcare provider can just apply a little bit of silver nitrate, which basically cauterizes and dries up the tissue. It's a simple, painless procedure that usually solves the problem after just a couple of visits.
Now let's talk about the one that often looks way more alarming than it actually is, the umbilical hernia. This is that classic outie belly button that can bulge out, especially when a baby cries or strains. All it is a little gap in the abdominal wall muscles where the umbilical cord used to be.
But here is the most important thing to remember. A staggering 89% of these hernias close up completely on their own, usually by the time a kid is 5 years old. In the vast, vast majority of cases, the body just needs a little time to finish the job. No intervention needed.
So when is surgery actually on the table? Well, only in very specific and pretty rare cases. If the hernia gets stuck out and can't be pushed back in, that's a condition called incarceration. Or maybe if it's exceptionally large and just isn't showing any signs of closing on its own. And sometimes, if it's still there after age 5, or for social reasons, surgery might be an option. But for almost everyone, the best course of action is just to wait and watch.
To understand some of the rarer umbilical issues, we actually need to take a quick trip back in time, way back, to about the 4th week of development in the womb. How this whole area is built from the ground up helps explain why certain strange things can happen.
Okay, our first key player from the past is the omphalomesenteric duct. Think of it as an early, primitive feeding tube that connects the developing gut to the yolk sac. In normal development, as the embryo grows, this tube isn't needed anymore, and it just vanishes. Completely.
But sometimes it doesn't disappear entirely. And depending on which little piece gets left behind, you get different outcomes. A remnant on the intestine? That causes something called a Meckel's diverticulum. A little piece left at the belly button creates a polyp.
And if the middle part stays but the ends close up, you can get a cyst. They're all just leftovers of this one embryonic structure that was supposed to fade away.
The second key structure is something called the urachus. This was the tube that connected the baby's bladder to the umbilicus early on. And just like that other duct, it's supposed to close off and turn into a simple ligament before birth.
And if it doesn't, well, you get a similar spectrum of issues. If the whole tube stays open, you have what's called a patent urachus, which can actually cause urine to leak from the belly button. If just a middle section remains, it can form a cyst. These are all rare, for sure, but they're a perfect example of how our embryological past can sometimes show up long after we're born.
Now let's shift gears to the most important part of this entire explainer, the signs that point to a real problem. While most of these umbilical issues are no big deal, infection is rare, but it is serious, and it requires immediate medical attention.
The medical term for an infection of the umbilical stump is omphalitis. This is what happens when bacteria invade the area before it has a chance to fully heal. It's rare in developed countries, but it can get very serious, very fast, if it's not caught early.
So what are the red flags? You're looking for any pus or a bad smell coming from the stump. You need to pay close attention to any redness or swelling of the skin that's spreading out from the navel. Any bleeding is also a warning sign. And critically, if the baby just seems unwell, maybe they have a fever, are unusually sleepy, or they're not feeding well, that's a huge sign the infection could be spreading.
And this is exactly why it's taken so seriously. The source material is crystal clear here. An untreated umbilical infection can lead to life-threatening complications like sepsis, that's a bloodstream infection, or even necrotizing fasciitis, a severe soft tissue infection. These are true medical emergencies. If you see any of those signs, the absolute key takeaway is to seek medical care immediately.
So as we've seen, that little belly button has quite a story to tell, doesn't it? It's a journey from a complex, life-sustaining organ to a simple scar. It's a process of separation that requires some careful attention, and it's a landmark that can sometimes come with a few harmless bumps, or, very rarely, a serious red flag. In the end, it's a physical mark of our biological independence. It's a healed wound that signifies the very beginning of a life outside the womb. It's really a fascinating testament to how our bodies are built, how they heal, and how they carry the story of our origins with them for our entire lives. What a remarkable piece of human biology.